Good morning. This is Dr. Martin's supplemental lecture on cranial nerves. I'm going to talk about cranial nerves 7 through 12 today. We talked about 1 through 6 in class last week, so I'm going to try to finish up. We're going to start with cranial nerve number 7, which is called the facial nerve. It has two functions that I want you to remember. It controls the facial muscles. So the muscles that regulate or control facial expression, smiling, frowning, whistling, all of those. Remember, we talked about orbicularis, oris, and some other muscles of the face. So this is considered that component is a motor nerve because it controls muscle. The second important function I want you to remember is actually a sensory function, because this is going to control sensory information from the tongue, from receptors in the anterior 2/3 of the tongue. So one of the most important sensory receptors in that part of the tongue is actually for sweetness. So if you're going to test for that function on a patient, you might put a sugar solution on a little swab and touch the anterior part of their tongue. So two functions, motor and sensory, for the facial nerve, cranial nerve number 7. All right, let's go to cranial nerve number 8. Oops. Okay, this nerve actually used to be called the auditory nerve, but it is now called the vestibulocochlear nerve. And so it has two sensory functions. It's going to control hearing, and it's also going to control equilibrium or balance. So if you sit someone in a chair, an office chair, for example, that you can spin around, someone who has a functional cranial nerve number 8 can maintain a sense of balance. Someone who doesn't cannot. All right, so that's cranial nerve number 8. So we've got 7 facial, 8 vestibular cochlear. All right, let's go on to cranial nerve number 9. And this nerve is called the glossopharyngeal. So glossal actually refers to the tongue, pharyngeal refers to the pharynx. So this particular muscle has several functions. I guess I'll give you 2. One is a motor function to the muscles of the throat or the pharynx. So this is involved in swallowing also involved in a reflex that's called the gag reflex. If you can trigger this by touching the very back of the throat, kind of far down in a patient, and that should trigger, like I said, a gag reflex. It also has a sensory function. And that is sensory. It controls or receives information from sensoreceptors on the tongue. And actually this is going to be the posterior 1/3 of the tongue. So the very back part of the tongue. And the type of receptors that are predominant there are for the sensation of bitterness or bitter. That's where you're going to taste that kind of chemical. All right, I'm going to stop now since we've done a few, and then I'm going to start up with the next video to do the remaining.